If it were easy to exercise, everybody would be thin and people wouldn't have those problems quite as much. So it's really about setting realistic goals that people can reach when they have, when they don't have any time to do it, finding a way to make time, even if it's, buying 15 minutes here, 10 minutes there, 5 minutes there, 5 minutes there, to add it up for 30 minutes of activity a day. I think for people to understand really how important it is, you kind of hear it, oh yeah, my doctor told me to lose weight, I know I need to lose weight, but actually seeing some of the studies and how impressive it can be that you reduce your risks of heart disease and stroke, those types of things. And when people want to be around for their families, for their kids, for their grandkids, decreasing your risk of the major things that kill people in our country as far as medical conditions go is good. And I think having a doctor who understands how to make that work, into your system. I could start with the president and work my way down, though Mrs. Obama currently has done a great job in trying to promote physical activity for young people. But I think it starts with the doc. I mean, I'm a doctor, I train residents, I think it starts with having the doctors understand how to prescribe exercise for your patients. And primary care doctors, my hat goes off to them because they have 8 minutes to address 25 different things. So having a 30-second spiel that you can give someone about how to incorporate exercise into their life, seated exercise, standing exercise, just getting up 5 minutes of every hour and marching in place at your computer can be a big deal for some people. So it's doing it that way, and also teaching doctors how to do it and how to make it important to their patients without the judgment that comes along with it. A lot of heavy patients come in and they sort of dread seeing a doctor that's going to tell them again that they have to lose weight. As a female doctor and as a relatively fit person, sometimes it can come off as very judgy. I'm just making it personal. In my family, 3 of my 4 grandparents had strokes. I'm one of 5 siblings, and two of us are healthy weight, and 3 of us have struggled our whole lives to try and maintain it. So it's very close to my heart. The people that I love most in the world struggle with their weight, and so it's a real issue. And I think being able to talk to people kind of openly about it without feeling like I'm going to make you feel bad or I'm trying to judge what you're doing. I'm just trying to get you to feel better. It certainly does. Clean your room, mow the lawn. It doesn't matter if it's your parents telling you, your wife telling you to mow the lawn, your doctor telling you to lose weight. It does lose its punch. I think as physicians, if we really want to incorporate and get our patients excited about physical activity, it's changing the way that we bring it up. It's not, okay, you need to exercise 30 minutes a day, 5 days a week. It's, what do you like to do? Because sometimes patients ask me, well, should I do the elliptical? Should I walk? Should I do the treadmill? Should I ride my bike? Should I do Zumba class? What should I do? And I say, I said, what do you like to do? And we find something about that, because the treadmill isn't better than the elliptical, isn't better than being on the bike, isn't better than walking laps in your garden or around your neighborhood and checking out, what your neighbors have done with their garden. It's whichever thing you actually will continue to do because you actually enjoy it. Like that's the thing, is finding out where is an activity that you can tolerate. Some people are outside folks. Some people don't want to go to the gym. Some people love to be in the gym. So it's just, finding the thing that gets them. Some people really like to dance around their house and they don't want to be in a competition like a triathlon or something else like that. So it's, if it's turning on music and while you're cleaning the house, you take a 5-minute dance break in between each room and that's what you do, then that's what you do. And that's what helps people to get going. It is, if it's done at a certain level. So, if you have 150 pounds to lose and you have been doing nothing, it's diet modification and physical activity. Your cardiovascular parameters change a little bit more quickly if you do 30 minutes of continuous exercise, but doing 15 minutes twice a day or 10 minutes 3 times a day still adds up to calories burned over time. And so that's really what matters. And of course, you can't say, well, I danced for 5 minutes, I can have this extra serving of French fries, or I danced for 5 minutes, I'm just going to stick with this whole milk instead of of using the 2% that my doctor recommended, or trying the, soy milk or coconut milk, or I'm in California, so we do those we do those types of things. But I think that it's getting activity as a part of your daily life, that's something that you enjoy, that is really what makes a difference. Because if you ate the same amount of food and you didn't do activity, and now you're burning more calories, you will lose weight. And it's not always just the weight. Sometimes it's your body composition. So you may weigh the same, but look differently in your clothes. Some people worry about, if I bulk up and put on muscle, if I do weight training, I'm going to put on muscle and then, I won't lose weight. But actually, when you put on a little bit of muscle, it burns more fat at rest. So you actually can eat more, and your body burns it more when you're sleeping, doing nothing. So that's where the lean muscle mass really can come in and help people. And it just changes. It changes how you fit in your clothes. It changes how you your ease of getting up and down, your ease of getting in and out of an airplane seat. You think about these functional things being in the community, and when you've got to squeeze down an aisle and you're 175 pounds of fluff and you're 175 pounds of muscle, those things look very different. So even small changes in your body composition like that can make a big effect on how you get around, how you feel, and how your health is.